Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, and boy, have I got a topic for you if you are a man or you are married to a man. We are going to touch on a topic that I've never talked about before on this podcast, but it has been a long time coming, and there's probably some things I'm going to say on this podcast. I'm not trying to make any sort of puns or trying to make anything sound funny, but it just probably will happen. But we are going to talk about erectile dysfunction, okay? Common causes and natural solutions. Erectile dysfunction, or commonly called, ED, is one of the common health conditions that is recorded with men. In fact, according to the Urology Care Foundation, it is estimated that 30 million Americans experience ED. Now, if you do the math and just get rid of all the ladies, that's a high number of men, and it's something that I would say is it can result in things like depression, low self-esteem, or maybe as a result of those things. We see that actually in our private practice. I would say it's more common than men actually report it because they're probably embarrassed to talk about it, and they shouldn't be. But it does come up. And the reason that it comes up in our office, you would think, well, why would that come up in a chiropractic office? Well, what are some of the things that bring men into our office? Well, sometimes they have headaches and neck pain and numbness and tingling and carpal tunnel syndrome. But they come for things like, lower back pain, sciatica, and the nerves that come out down there actually go into the organs of the pelvis, including the sex organs. So if you're not getting proper nerve supply to the organs and glands, it just makes sense that over time, and given a long enough time line, they're not going to work as good as they could. So what is erectile dysfunction? So erectile dysfunction is simply the inability to get or maintain a firm enough erection to have sexual intercourse. The condition is sometimes it used to be called impotence. Many men experience ED, during times of stress, but when it becomes frequent, is a clear sign of health problems that need medical condition. It makes sense that it happens during stress because when you're trying to run from the tiger, the last thing you want to be thinking about is having sex and having an erection. But my definition, or what I'd like to add to the definition of erectile dysfunction is, to what degree does your man part not work as good as it did when you were in your early 20s, okay? Because when you're in your early 20s, that's when a man is at his peak in terms of his ability to perform sexually, whereas ladies, that tends to happen mid-30s, even into their mid-40s. So to the degree that it's not working as good as it did when you were in your early 20s, that's the degree of erectile dysfunction that you may have. Now, an erection is normally achieved, when there's increased blood flow to the penis, obviously, and this happens, when the man is sexually excited. The muscles in the penis and all of the little things that absorb blood flow in there and the arteries and all of that basically cause the penis to rise or go up or get hard, if you want to put it that way. Okay, so what are the causes of erectile dysfunction? Well, there's a ton of them. So many of them, can be physical and emotional conditions. However, common causes of ED are things like cardiovascular disease, high blood pressure, diabetes, obesity, kidney disease, anxiety, stress, depression, high cholesterol, low testosterone levels, sleep disorders, and certain prescription medications. Now, the prescription medications that can actually cause erectile dysfunction, there's numerous ones that have been implicated in it. So that's why it's important to always consult your doctor before changing or stopping your medications, of course, because I'm not a medical doctor and I can't give you, any sort of medical advice on this sort of stuff, just as a little quick disclaimer. But some medications that can cause erectile dysfunction include that we know about are heart medications such as digoxin, drugs that work on the central nervous system, including amphetamines or sleeping pills, drugs to control high blood pressure, anxiety treatments, some diuretics, prostate treatment drugs, opioid painkillers, which is a huge problem in America, Antidepressants, including things that are what are called MAOIs, or tricyclic antidepressants will also do it, and some SSRIs or selective serotonin reuptake inhibitors. Also, anticholinergic drugs, some cancer drugs, peptic ulcer medications, and hormone drugs. Now, what are some natural solutions or some things that you can do for erectile dysfunction? There's a lot of treatment options out there, drugs and surgical treatments and all those kinds of things. But, I'm always like to say, go conservative first. Try the things that are just, don't really cost you a whole lot to actually be able to do it and don't really have any big-time side effects either. So there are things like exercise, certain exercises like Kegel exercises, which is, you can Google this, just look up Kegel exercises, and just do the reps that put it in there. Cardiovascular exercises have been shown, like running, swimming, riding a bike, maybe not so much on the bike, running and swimming, because riding a bike can actually, put pressure on the prostate. But yoga also can release your mind and ease stress and anxiety from the body. Eating a healthy diet is another one, So things that increase blood flow, like whole grains, fruits, vegetables, getting rid of, processed sugars and, bad fats, and limiting and or quitting alcohol depending on, your sensitivity to it. Now, what are some natural herbs that you can do that might possibly, or at least show a lot of promise for erectile dysfunction? There is a particular form of asparagus that you can get: ginseng, DHEA, yohimbe, and one that's called, no surprise, horny goat weed. Acupuncture also has been shown, because what does it do? It increases the flow of energy, through the body. So it's very traditional, and it's like it also creates nerve stimulation as well, and the release of neurotransmitters. There are, you probably never heard of this, but there's a thing called a prostatic massage, where you could actually have a therapist, sort of massage around the prostate, around the groin area. However, chances are you could probably find a YouTube video or look up some article that would show you how to actually do that yourself. The thing is that this doesn't have to increase with age. You don't have to lose performance. You don't have to lose your ability to get an erection. But if you're under high stress all the time, if your body isn't working correctly, if you're not nourishing it correctly, and your body is just under functioning, because the reality is, if you got erectile dysfunction, chances are you got a whole host of other problems, other health problems, whether you have them diagnosed or not, whether you know they're there or not. By the time a person has erectile dysfunction, their body is real, other than some sort of trauma or something like that. Their health has already gone way, way, way down. So I hope this helped you. Forward this to a guy or a lady with a guy that needs to hear this information. And I'll see you guys on the next podcast. See you later. Bye-bye.